Joe Mullings from 160 Studios, and I've got Scott Pantel from the dark side over on the West Coast, which some say is the best coast. Good morning, Scott.
Good morning, Joe. Great to be here. Thanks for having me.
Yep, and we've got a really exciting guest on this morning as we chat about LSI 2022 in the EU. Would you introduce, please?
Yes, Anne Osdoit, thank you so much for being here today. Really excited to have you at the meeting, and we'll be talking about it, I think, a bit about the multiple hats that you wear, but today I think you're mostly representing the CEO of Moon Surgical hat. Thanks for joining us.
Thanks for having me. It's great to be here with you.
And thanks for being on. We certainly appreciate it and looking forward to seeing you in person at the event coming up in the fall. If you can, share as much as possible about Moon Surgical. It's been, as they say, stealth for a while. I've got a lot of friends over there and people I really admire. And you've got one hat in Sofianova and one also leading the Moon Surgical push. So share a little bit about the technology and the intention of the platform.
With pleasure. So yes, so Moon Surgical has been relatively quiet until we announced our Series A few weeks ago. And Moon Surgical is a company developing a surgical support platform, which is designed to be used in any operating room by any surgeon in any laparoscopic procedure. So we're developing a surgical robot that will be very simple, very accessible, that will keep the surgeon at the bedside, that will enable usage of conventional laparoscopic instruments and essentially augment the surgeon with an additional set of arms and hands so that the surgeon by himself or herself can control everything that's happening during that surgery while being at the bedside.
And so that goes for visualization systems as well as lap tools, whether they're straight stick.
Exactly. Visualization system, tissue exposure, and then the active dissection instruments typically.
And I know you're still somewhat stealth, if you will, and congratulations on the recent raise.
Thank you.
Is there a digital component to this, an intelligence side to this, as most of the robotic systems are espousing?
Absolutely. The very unique thing about our system is that we are keeping the surgeon at the bedside, and the surgeon is operating with the surgical technique that he or she learned in med school. And we are just equipping the surgeon with basically a way to hold and maneuver additional tools and instruments and the scope, etc. What that means is we're capable of measuring the movements that the surgeon, instructs, or provides to these instruments, and so we are basically equipping the surgeon with direct sensing, and we are collecting this information as the system is used by the surgeon, and obviously then have an ability to learn how a given surgeon likes their scope positioned in a particular clinical procedure, how they like their tissue exposed, how they do the dissection. And that is information that we'll be able to leverage, of course, in order to include some automation and some intelligence in our system down the road.
And so the market for quite a while has been requesting this hybrid approach, and I'll call it hybrid. You don't necessarily have to call it hybrid, but most of the other soft tissue platforms have had the surgeon removed from the bedside, and some of the surgeons aren't comfortable with that as much as being bedside. So was that the impetus for the platform development? And where do we go from here potentially?
I think it boils down to the market you're addressing. We view our system as becoming an essential tool of any operating room, whether it's in an ASC or a larger surgical outpatient department or even larger hospitals. We view our system as being in every single OR. It's not a specialty robot. It's not something you would use for sophisticated procedures and indication. It's something that will be very easy to set up and accessible in terms of its usage. It doesn't require any specific training. Which means that it can be used in short, high volume procedures where it might not be worth to use one of these larger platforms.
So obviously,
I view both as very complementary, basically, and we're addressing basically probably a larger pie in a very different setting.
And so I'm imagining smaller footprint, easier setup, lower cost, lower maintenance, outcomes still to be determined, obviously, but it sounds like what we're doing is providing an exoskeleton to what we're doing already and getting data off of that as the
That's
surgeon,
exactly
as he
right.
or she
Yeah.
conducts their technique. Do I have the same haptic feedback? Is any of it amplified? Is there any sort of sensitivity lost while I am sitting in that Moon system?
So the system is completely transparent mechanically when the surgeon maneuvers the instruments. It does compensate for gravity, so we're actually even perfecting that haptics feedback. We are deducting gravity information from it, and we're not interfering with the movements of the surgeon. So there is indeed a very truthful haptics communication. Yeah.
Scott, question for you. Anne and Moon coming over there. It's exciting. It's a technology that the genesis, if I'm not mistaken, is out of Paris. And this starts to reflect the mosaic of what LSI 2022 in the EU looks like. What was your thinking about that as we pursue the OUS market on the meeting?
Yeah, thank you. And by the way, I was going to ask Anne, one of the questions I had all prepared for this meeting was, why do we need another robot? And so that's obviously been preempted.
I hope I answered that.
You answered it great. And Anne and I were chatting about this just prior to this discussion. And so really, what we've seen in the U.S., we've been running meetings in the U.S. for many years. And 4 years ago, we kind of rethought the vision and the structure and what do we want to get out of this. And here we are in the U.S. Coming up on 4 years, and we've got some tremendous momentum. We're seeing great things happen. Companies are getting financed, deals are getting done. And then some of these other hard to measure intangibles are also coming out of the meeting. And these are things like relationships established, connecting with people that you thought came in representing maybe the CEO of a company, and you find out that they're also an investor, which Anne falls into that category in many ways. And by the way, you said she wears 2 hats. I think she wears 3 hats. And MDstart is another thing that I hope we can talk about a little bit before this call ends, because I'm intrigued by what's going on there. But to answer your question, we're coming to Europe as guests from the US, and we're coming to Europe to hopefully begin to establish the very special thing that we built here in the US, which is an ecosystem where we can bring together the best of best innovators, active investors that are really investing, and committed strategics that want to do deals. And then the other group of the ecosystem, which are those that may not be investing or doing the acquisition, but they play a really important role in helping companies grow. We've continued to have 15 to 20% of our attendees here in the US come over from outside the US. And they've been working on me a little bit, and they've said, hey, you got to bring something over. So, our hope is that with the help of incredible innovators like Anne here and investors are really supporting the meeting just magnificently. We're hoping that we can start to establish something in Europe that we can build on so that we can grow all of the global ecosystem really and have something as important in Europe as we feel we do here in the US.
Mm. And Sofinova also is one of your keynotes the first evening, a Sofinova luminary, if you will?
Yeah, we've got Antoine Papernick doing a fireside chat to kick off the meeting with us. I secretly am going to chase down Anne offline and get some inside scoop. I mean, I think everybody knows Antoine and Sofinova as a whole is such an important firm that and we want to make sure that it's special. We have a little bit of fun, and that I say fun. That's a really important part of what we're trying to do as well. Is we're all working so hard, but we got to have fun along the way. So we try to host the events in places where you can walk away with some great memories on all sides of the table. And we're hoping that Antoine can help us get things kicked off with some insights, no doubt some vision, and also we'll have a little bit of fun.
And that third hat that Scott referred to, MDstart, if you wouldn't mind, share a little bit about that with us.
Sure. So MDstart is a medtech accelerator. It was started about 10 years ago, really initially as an experiment by Sofinova, very shortly joined by a number of strategics, including Medtronic. And the goal at that point was to identify technology, typically residing in hospitals or labs, and mature them to a point where they would be of interest to VCs or corporate VCs. And so the model has evolved over time. We're now at our third venture, and that third venture was now integrated into Sofinnova. It's one of the funds managed by Sofinnova. We are, part of the Sofinnova, strategies. And we have created and accelerated 11 companies to date, a number of which are, of course, in the clinic, have their now independent, lives and investors and teams. And Moon is one of our most recent projects out of MDstart.
Thanks for sharing that. Question I have, you mentioned ASCs, and you're one of the few surgical robotic companies that probably is set up really well for the changing centers of care, where most robots, they're super expensive to fit into an ASC, if you will, especially on the soft tissue side. Ortho, maybe not as much. But what do you think about the impact of the changing centers of care, and how do you think ASCs are going to influence the design of products moving forward for surgeons?
That's a great question. We speak with a lot of executives from ASCs about their pain points, and their pain points are a lot about surgeon retention, keeping their surgeon happy, which proves to be difficult due to staff shortage issues recently, and COVID only aggravated that. And also, part of the rationale for keeping surgeons happy is providing them with the tools that will make their lives easy. And I think we have a great story to basically volunteer there, and a great place to play at these sites. In terms of product design, it comes with a number of additional requirements versus what you would do to bring a system in academia, for instance. The two fundamental ones are usability and reliability. And we were told, do not go into the ASC market if your system is not super easy to use, completely fail-safe. There is no way you even ask these people to troubleshoot for anything. I mean, you are dead if you get there. And the second thing, as we said, was reliability and robustness. You need to make sure that your system has been extensively tested, that it's serviceable, and you need to have the resources and the infrastructure to provide that service.
Yeah, those are fantastic points. The resources in an ASC are dynamically different than they are in a standard hospital. So great point there.
It's much more efficiency driven, basically.
Yeah, for sure. And different economics too. The models are tremendously different. So that sets up well for Moon. And then my final question for you is, it seems like there's quite a bit of surgical robotic activity coming out of France.
Correct.
Right? You're really punching above your weight in relative terms, which is really impressive. What's the genesis of that push coming out of France for these platforms that are emerging currently?
It's a combination of a few things. I think it's of course notorious that France has a good school around mathematics and great software engineers. And as we see those robotics platforms getting more into the data aspects, I think we have probably a unique advantage in terms of just recruitment. We also have a number of labs which have been working for years on prototypes, like the lab where our technology originated from, and they have functional things that are ready to be transferred into companies, and this effort is coming to fruition basically now, or in the past 5 years and in the coming few years. There is also a strong cultural shift in France, and I think more generally speaking in Europe, towards entrepreneurship and medtech entrepreneurship. It's another reason to be coming to Europe from LSI's standpoint, and a just stronger and stronger ecosystem of CEOs and technical resources who want to embark on those projects. So we feel we're in a good crowd. We feel we can hire people here. We feel we can attract people here. My chief strategy officer, Jeff Alvarez, moved with his family to France a year ago, which we wouldn't have even imagined 5 or 10 years ago. So we're very excited with the environment.
Say hello to Jeff for me today. He's a close friend. And anything you can share with us now, or maybe at LSI, in regards to where are we clinically, and what sort of evidence have we got coming out of clinics with your platform?
So we've been working hard over the last 18 months to, of course, transfer the technology, but then redevelop a functional prototype that we could bring into the clinic. We should have very exciting news between now and LSI, or in September, that we can share at the meeting about our progress. And we are a fast-paced company, so you should expect some interesting results very shortly.
Excellent. Scott, would you take us out, explain the meeting, the location, the dates, and how they can reach you in order to join this party?
Absolutely. Thank you, Joe, and thank you, Anne. So we'll be at LSI 2022 Europe, and we will be in Hertfordshire, just outside of London, September 21st and 23rd, September 21st through the 23rd. And we're going to have tremendous companies like Moon Surgical there, active and committed investors like Sofinova. We keep the meeting fluid. If you stay close to our program, you'll see new companies added regularly. We keep the content fluid. And you've spurred a couple thoughts, and maybe we can even build a panel session around some of the work that you're doing with MDstart. But we've got a tremendous turnout. The meeting's filling up quickly. We'd love to have everybody out, and we're happy to be the guests coming over to Europe to hopefully build something special. So thank you.
Fantastic. Well, Anne, thank you for your time today. I really appreciate it. I know you're super busy.
Thanks a lot, Joe.
Yeah,
it was great. Thanks,
and
Scott,
looking
as well.
forward to seeing you over at the show. And Scott, as usual, my friend, thanks for bringing the magnificent show to our great industry, and look forward to seeing you over there as well.
Thank you both.
I'm Joe Mullings from 160 Studios. Be well.